Hi folks, it's Dr. Mike and we're back here to continue talking about our medical exercise specialist career success path. Now, we're now looking at the second point along the pathway, which is application. Now, this one is important. We talked about foundation earlier. Foundation is where you get just that, the foundation. You learn clinical anatomy and pathology, medical terminology. You learn how to manage medical conditions utilizing exercise. And we recommended our medical exercise specialist workshop, whether the on-site or the online workshop. But you can certainly take anything else out there. But the key is make sure it has a very in-depth and comprehensive clinical anatomy component, not just simply basic gross anatomy, but clinical anatomy component, and then also a component that talks about how you specifically manage medical conditions with exercise. Not just simply do this exercise for these conditions, but more importantly, understand the clinical anatomy and pathology. Here's why you're doing this exercise, and with that, here's how you dose the exercise, how many sets or reps or what you should see along the way, and even the sequence for the exercise. That becomes important. And then you're now ready to apply this information. Now, the application is where you actually really begin medical exercise training. And we do advocate, as our medical exercise training students are going through the course, we advocate that they go out there and start working with clients. Now, not the most complicated clients, not clients with multiple conditions that are heavily involved, and definitely never take clients that should be in physical therapy, occupational therapy, or receiving chiropractic care. But we do recommend at this point, this is the application component, so start training clients. Take that information that you've learned in the MES course and now start applying it. And as I said before, work with lower level clients that you can work with and work with appropriately and produce outcomes, and continue with those observation hours. We highly recommend, as you go through our medical exercise specialist training program, that you get out there and start doing observation hours in the physical therapy, chiropractic, and the medical clinic, so you can really start to see up close and personal these various conditions in the acute and subacute stages. When they're in a clinical setting, you'll be familiar with that and you'll understand how to transition them into exercise when they enter the chronic stages. We highly recommend at this point that you seek out a physical therapist, a chiropractor, or another MES with more experience to be your mentor, to have someone to bounce ideas off of, to ask questions of. Now, if you don't have that and you're going through our MES program, I'm always available, or one of our other physical therapists, but you do need to start developing a mentor type relationship with some medical exercise professional or medical exercise specialist in your community. And the last component here is the idea of participating in case conferencing or case study conferencing. One of the things that we've learned along the way is there is a bit of a thought process in the fitness industry that I don't want to share too much information on my client with another trainer, and I definitely don't want to share too much information that shows I may not know something specific that's going to help my client, because there's a possibility that someone else may come along and be able to woo the client over to them. Now, we certainly don't see this in the medical realm, or we see very, very little of it. I imagine it does go on, but we see very little of it. It's essential that you now start communicating with other medical exercise specialists out there and share with them some of your challenging clients, what you're doing with them, or maybe what you're not doing with them. And then what we find is with this case conferencing concept, it allows you now to bounce ideas off of other physical medical exercise specialists, and then they can share that information with you, and you can even bounce ideas off of physical therapists and chiropractors with regard to how you manage these clients once they've gotten the medical exercise training. I think it becomes essential here that as you go through this application point along the pathway, that you do start communicating with other medical exercise professionals and let them know some of your challenging situations. It's always better, two heads or two brains are always better than one, but along the way, if you're sharing information and you're getting information, that just simply makes you a much better professional along the way. And I know for me, as a physical therapist starting out, it was invaluable being able to talk to other physical therapists with regard to their challenges with their patients and offering recommendations on the types of treatment or guidelines that I should utilize in helping me better manage my patients. The same thing should hold true for you, the medical exercise professional out there working with your clients. So again, as you're going through the medical exercise specialist in this application point, start getting out there and training clients. Continue those observation hours, and with those observation hours, see if you can make that doctor, therapist, or chiropractor, that MES that you're observing under, See if they can become your mentor. And with that, start sharing with other MESs or other MES students some of the challenging cases that you have so they can maybe give you some ideas, or you can share some of your thoughts on their challenging cases. It makes a huge difference in building the profession, building camaraderie, but most importantly, it helps with your professional skills so you can be at the top of your game to build a strong practice, communicate effectively with medical professionals, most importantly, produce outcomes for your clients. Now, the third step along the way is management, and we'll get to that one in the next video. If you have any questions with regard to this video, please email me at drmike@postrehab.com. And you can go over to www.medicalexercisespecialist.com to get more information on our MES program. Thanks again. We'll see you in the next video.